Are you a woman between the ages of 50 to 100? Do you have overactive hair follicles? Are you embarrassed to go out in public because of your lady beard? Well, if you answered yes to any of the following questions, then I'm afraid you're in the wrong video. Today, we'll be talking about, that's right, pussycat, cystic fibrosis. Allow me to introduce you to one of our actual CF patients, as well as her mother. Come on, follow me. It'll be fun. Come on in, Doc. Miss Bertha O'Donnell, pleasure to see you. Look who's got a bun in the oven. Come on, have a seat, Doc. Let me introduce you to my daughter. Hi, Bianca. I'm Dr. Leone.
Hello.
So, Barbara.
You mean Bertha?
So, Betsy, tell me, where are you financially right now?
Right now, my job's paying me about $35,000 a year. Got a baby on the way and 3-year-old CF.
I'm so sorry. So, how are you with insurance?
Doc, let me tell you what their daddy did. They daddy did. He cheated on me with this other girl, and I know it. But he gonna come up here talking about he love me when I know he don't love me because he don't pay no child support. Help me, Doc. Help me.
Pull yourself together. I am a doctor, and I'm going to make sure that your 3-year-old with cystic fibrosis is going to get the best quality life she possibly can. And I'm going to do that by giving you tips. Tips that will help you and your daughter, Bianca. Tip number 1.
Getting exercise.
Come on, baby girl, go, 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 go.
Eating proteins. Staying away from smoke.
No, baby girl, don't touch that.
So, Bertha, I'm now going to recommend you to a genetic counselor.
Oh, thank you, Doc. Thank you. Excuse me, counselor. I have an appointment today.
Oh, hello. Don't mind me. I was just doing my evening yoga. Please take a seat. I've been expecting you. So, it says here you have an online report. Let me just log into that. So, do you know the cause of such a condition?
No, I don't.
Well, the cause of this condition is purely genetic. As you can see here in your report, take a look.
I see.
It is purely genetic, as I stated before. You and your husband both had to be carriers in order to pass on the trait to your child, 3-year-old Bianca. And, unfortunately, there is really nothing that can be done to prevent this, as you can't do anything to change your genes. Yes. Well, some treatments. Would you like to learn a little bit about that? It says here that you had questions. Yes, alrighty. Okay. Well, there are many things that you can do. You can control lung infections. That helps a lot. You can have a transplant of the lungs. It's a very, very tricky process, okay? So, wouldn't recommend it. Mainly, you want to provide a good, healthy nutrition. But medications. Is your child on any medications? I don't think so, right? She was diagnosed at 2. Yeah, no. You can take antibiotics to prevent the lung infections, mucus thinning drugs, less coughing, less sort of that thing. It improves your lung function. You can take bronchodilators. You can take oral pancreatic enzymes. That helps your digestive system absorb the nutrients so that your daughter does a little bit better on those medications and with those proteins. You can also do surgery, other procedures, as I stated before, oxygen therapy, and nasal pulse removal. Pretty much that's about it. Those are your options. Listen, if you have any more questions, please feel free to email me, call me, text me. Whatever time is really fine.
Oh, shucks.
Good game, Bonnie. Some symptoms of cystic fibrosis include shortened breath,
Salty glands,
clubbed fingers,
fever,
delayed growth,
eating, but not gaining weight.
Unfortunately, there's no cure for cystic fibrosis, and the treatments mentioned can cost up to $35,000 or more. Hey, educationally speaking, your child may be just as academically capable as the rest of the students. But cystic fibrosis puts them in a special category because of their frequent absences due to hospitalizations, medical treatments, and you need teachers that will be ready to jump in to teach them lessons that they cannot learn in a matter of 2 days. Medical procedures can vary from child to child, student to student. Some students, for example, may use portable antibiotic devices, while others may have daily meetings with their parents or nurses or other caretakers that come in the middle of the day while they leave class and take care of their medical needs. In conclusion, cystic fibrosis is a genetic disorder that causes much financial stress on one family and can heavily affect a student's academic life.
Welcome home.
I'm the doctor.
Have a seat, Doc. Have a seat. Welcome to my
You didn't introduce her yet.
I know, because you passed the ball. I'm not going to introduce you while you're on the ball. Oh, shucks.
Good game, Bonnie girl. Some symptoms of cystic fibrosis include salty fingers.
Salty fingers.